Cardiovascular disease, also known as CVD, is the leading cause of death in Australia and includes all diseases of the heart and blood vessels. The most common is coronary heart disease, but includes cardiomyopathies, malfunctions of the valve or heart rhythm, inflammation or stroke. As we continue to expose ourselves to stress, tobacco, poor diet, alcohol and inactivity, the likelihood of CVD is increasing, and so it is vital that we find efficient and effective medical treatments as second-line defences if lifestyle modification is just not enough. Today on Medical Corner, we will be looking at the new wonder drug that addresses CVD. So first up, we have Dr. Spirin to talk us through what drug combinations are being tested. Hi Dr. Spirin, thanks for coming in. So tell us, what are the drug combinations being tested?
Hi, thanks for having me. It is recognized that CVD incidence can be reduced by simultaneously targeting CVD risk factors such as high, low-density lipoprotein concentrations, cholesterol, raised blood pressure, increased serum homocysteine levels, and platelet aggregation. This is where the polypill comes in. By definition, a polypill is a single pill that contains 3 or more drugs used for the treatment of CVD. Thus, the polypill is a tablet that contains a combination of the drugs that address each of the previously stated risk factors. Generally, they consist of a statin, a blood pressure lowering agent, an aspirin, and folic acid. As a relatively new drug, a number of combinations of these drugs have been created. Our research has identified 4 main combinations. Clinical trials have observed that type 1 combination is the most effective at decreasing stroke and projected coronary heart disease, whilst type 3 was the least effective. Overall, time will tell the long-term efficacy of each of the different types of polypills.
Thanks, Dr. Spirin. Now that we have a little background into the drug, we sent our hard-hitting correspondent Jemima Partridge to speak to patients and relevant cardiovascular professionals to ask their opinions on this new development.
Thanks, Wendy. We're here now with Dr. Stan. So, Doctor, what do you think about this new wonder drug, the polypill? Would you prescribe it to your patients for CVD?
I'm still unsure because I feel like more research is needed to conclude its safety and its efficacy as a CVD drug. Some researchers have already suggested that there may be adverse effects to one drug within the polypill, resulting in total cessation to all the other drugs, because you don't know which drug is causing these effects.
Are there any other concerns?
It's a fairly new drug, which means that it'll be more expensive, especially with all the research that still needs to be done.
Now we're speaking to Maree, our resident dietitian. What's your role with CVD patients, and what do you think about the polypill?
Well, I work with them to adjust their salt and fat intakes for a more balanced diet. I think this is of great importance as it reduces the risk of CVD symptoms without any drugs. Concerning the pill, I do strongly think that it would be great for people who really need it, but I would strongly suggest to my clients that they adjust their lifestyles before they do anything like that.
We are now talking to CVD scientist Dr. Cole. Do you think there are any issues with the drug?
A pertinent issue revolves around the stability of the drug. Because a polypill is comprised of multiple drugs, we are concerned that the different components of the drug may unfavourably interact and cause chemical or physical instabilities. This instability gives rise to a lot of ramifications. Furthermore, there may be drug-excipient interactions. For example, the polypill may exhibit interactions with improper packaging material. As a result, this drug may be highly unstable.
So, John, how long have you had CVD for?
I've had CVD for about 11 years. High blood pressure runs in my family, I guess.
So what do you think about this new pill with all the different drugs in it?
Oh, a bit of an old dog. I don't know if I like these new things. But yeah, we'll maybe give it a little try, but just concerned about these side effects. What if I don't want one of the drugs in this pill, in this polypill?
Thanks, John. So there you have it. Back to you, Wendy.
Thanks for tuning in to Medical Corner tonight. We hope you feel more informed about the polypill now. Tune in next week to find out about Botox and cerebral palsy. Is there a link? Thank you and good night.